Hello, my third year residents. Yeah, this video is specifically for you and what are your expectations, what has to be done in the third year itself. I'm setting it out a timeline. It's not an hard and fast to follow all these timelines, but I know it will be much helpful for you for preparation of your exams and what all to read, how to prepare for your exams. Third year is very crucial where you are in all the stress, whether will I pass the exam, how will I do in exam. I've just focused first 2 years on doing clinical work. I've not studied. Yeah, everything, whatever part comes in your learning, everything you have done in a very good way, and you will pass. Everyone gets passed. You don't have to worry about whether you'll pass or not, how it will be for you. So, as also I have made videos for the first years and second years. You can share it with your juniors so they may also know, and your work gets a bit less. Then they know what they have to do in their specific years. So yeah, let's coming to this video. Oh, for the third year you have to make sure that you have finished out your at least one reading in before of the major topics whatever can come in examination by the end of your second year. You have also make sure that you have collected your sample size, you have making your introduction, your review of literature of your thesis, you have made the excel sheet it and computed the results out of your thesis title and all the sampling which you have done. You have computed your results out, and now this third year becomes very crucial where you have to make sure that within the first 3 months itself, max 3 months, you finish out for the thesis, have done your conclusion discussion and summarizing in the topic of your thesis, whatever the title which you have selected for your study, and you have finished it out in the first 3 months. Get those theses be corrected by your seniors, because I know the correction is the most difficult part which you have to do repeatedly. You have to ask your seniors, you have to ask your lecturers, then there is a stepwise manner where how you proceed it out for doing the corrections. First you show it out to your seniors, then the senior residents, then you show it out to your lecturers, and then and then your guide. So there are too many corrections coming down the lane. Make sure you're doing that corrections that there and there itself and finish it out your work. And that's why I was saying your first part of reading, if you're finishing two readings before second year, it's very good. First reading in first year, second reading in second year, and third reading in your third year, and you're just revising it again and again. But if you're not, at least make sure that you're finishing your first reading itself by the end of the second year. Now in the third year, by this time you have collected all the material, you have read out all the books which are required to be read. Yeah, I have made a video also on what are the books which are required for pediatrics. Do share it with your first years so they can know what all books they require, and the second years they know that what all books they have to read by the end of the second year. By the third year you must have been collected your materials, what are the important lines, or what are the important paragraphs, or what are the important things which you are going to revise in your third year. These topics you have to keep on revising. Most of the colleges don't send their pgs in the second year for paper or poster or publications. Make sure you're doing it by the end of the second year. If not, at least in the first 4 5 months of your third year you have completed publishing out your data, because that becomes a mandatory NMC guideline. And yeah, so this is the work you have to finish in the first 3 months. So the next timeline, the first 3 months of the third year is very crucial part where you have to complete your thesis, and by the 4 month you complete your publication, and also you try to revise out what you have learned in the first and second year in the first 3 months, like 3 4 months. In the fourth month, like the fifth month, you can try starting out again your the third revision, like you have finished your first revision by the end of the second year, the second revision by the end of the by the first 4 months of your third year, and then you start out with your third reading. And make sure that at least before the exams and prelims, I know it becomes sometimes difficult to carry out two or more than two readings, somewhat that becomes a path. But at least make sure that you have done with the three readings itself before prelims, so your fourth reading goes after prelims, and prelims is the time you just focus on your theory and practical. And before prelims, make sure, like after the first 4 months of your third year and till the time of your prelim date. This is the timeline where you have to make sure that you have finished your theory also, your practical also, because practical dates do come from the universities, and it can be very much earlier, like as soon as you finish your theory exam, the next day can be your practical exam for some institute, or within a 2 or 3 days, or for some it can be also be months. It happened with our batch that months and months the practical exam was been going out. And yeah, this scenario can also happen, but to be on a safer side, make sure that you have also learned and revised your practical stuff whichever is required. For practical, make sure that you have followed aruchami or cheda, whichever you're following for your history taking examination. Make sure that you have read your examination part. I know during taking history in your first year you might have read it in first year, in second year you might have revised it for your case presentations, but third year is a time where you have to focus on much yielding, how you're coming out to the diagnosis, and with those examination and history findings, how you're ruling out various diseases, and what are the differences which you have to come out. In the practical exam it is going to be very like not easy I can say, but you have to show them that what are how you're ruling out each and every disease and coming out to those differential. It is not mandatory for you to come out to a diagnosing point. Make sure that you have read out those differentials, what can be those differentials for those disease. Few topics are very much common, like long cases are always the CNS and the cardiovascular system. The CNS case, it can come being a cerebral palsy. Cerebral palsy cases are much more common coming as a CNS case or a hemiparesis. Then for CVS you can have a rheumatic heart disease, or if you are having any congenital VSD or an ASD or any of the congenital heart diseases, that can also come depending during that time whether your junior has admitted that patient for an examination, or whether your seniors have told your juniors admit this patient for your examination, like and call during your practical exam such cases. So make sure you're done with the list. In syndromes, you have to make sure you know Downs, Edward, Turner, Klinefelters, and Patau. Other syndromes like the Pierre Robinson, or the other ones like Cried Chat, or there are various Williams syndromes. Those you may not remember, that's okay. So going out, like you have done with your history taking, your examination, you have finished out all the system examination, and also focus on the general examination, because general examination do carry a point. Most of us like just forget out what to do. Just make sure you're checking out those tons in the examination, you're checking out the SMR also are some of the stuffs like you forget it out, checking sexual maturity rating, like the Tanner staging in the males and the females post 10 years you have to check. So if your case is more than 10 years, make sure you're mentioning a Tanner staging in your general examination and your head to toe examination. Also the physical examination, head to toe examination, you must remember at least one or two differentials for every of the type of the defect which is coming from head to toe. So be it a color change in the iris, or be it a deformed ear, or be it a syndactyly or a polydactyly. There are various there are various things like nystagmus or a squint. So you know what are all your differentials for a unilateral or a bilateral squint or a bilateral nystagmus, like everything you are knowing out by for the examination point of view. So long cases do carry, there are ideally one long case. For us it was like one long case, and short cases were three. One was neonate, so and two were short cases from per abdo or respiratory system examination. For newborn you can go through the aruchami or scots. Most of the people do follow scots as well, I forgot to mention the name, for preparation of their practical examination, because those gives the direct questions, and those people do say that those are only the questions being asked in examination, but no, it is not such. Most of the questions are not from scores, but yeah, for preferring what all you must read and you must know, that is there are points which you must know, but there are no mentioning of the point that this will be asked in an examination. You have to be pit and pat with most of the topics. For abdo cases, you can get a nephrotic case, a sickle or iron deficiency, anemia, these are some of the mask or anytime lump, but these are very rare cases. Those are the surgical cases. For a respiratory, you can obviously get a pneumonia or tuberculosis. You have to know the latest guideline, the latest what is going on. Every year the guidelines do change, and for my examination the guideline did change. You also have to know the GINA guidelines for asthma. The asthma cases are also very much common. Bronchiolitis and yeah, bronchopneumonia, these all cases, the x-ray differentials for bronchiolitis and bronchopneumonia. These are some of things you must know. For a newborn, you must know the head-to-toe examination for the newborn, the Ballard scoring, what are various of the programs going on for the mother, the child, what are the amounts they have been given by the government. These are all been asked for my examinations in the final year at university, and I know these are the common topics which have been asked for. And instruments, there are like a set of instruments you have to make sure that you're done. The instruments, drugs, and I know drugs you cannot do at a last moment. Make sure every day you're reading out one drug, one instrument, or one nutrition topic and one vaccine. This helps you out by the end of like the 1 month. You are ready with vaccines also, instruments also. Every if you sit and read just instruments only, you're not. Some people do like reading out all the instruments in one go, all the vaccines in one go. You can go with that way also, but this is also an easy way where you will not just overwhelm yourself by just reading the theory. Along with theory, in between 2 3 questions you can or 2 3 topics you can just go about a vaccine examination or nutrition or an instrument, x-ray, ECG. So these are the topics which can be asked, but much more focus will be on your long case. Your long case decides what are the marks you're going to get, like what is the percentile you're reaching up to. And short case do add to it. Just don't say that long case is good, it's done. No, make sure that your long case and short cases are gone well. And the x-ray, ECG, drugs, vaccines, instruments, and nutrition, these are all small stuff. They sometimes they are very, examiners are very picky about asking their only specific stuff and what are the recent advances going on, so better you stick to that. By the second year, also make sure of your residency that you have a set of all the recent advances going on, like what are the guidelines recently established. Most of the that the fourth paper, like we have 4 papers. One paper is anatomy, second paper is more of a neonatology and a general pediatrics, and third paper is all the systemic, and fourth paper is your recent advances. So by the second year, make sure that you have made out all the materials which you require for your recent advances, and what are the recent advances going on, the papers, everything you have read, and you have that material by the end of the second year. And yeah, so for the point of view revising, for the first paper and second paper, it's very much easier for you to revise. First paper also you can do it because you have a lot of days prior that, and second paper also you can revise it very easily. But what comes important is your third paper. Revising a day prior for your third paper is very much difficult. So make sure that you have revised your third paper, like the systemic topics, very much often as compared to the first and second paper, like the general pediatrics or the anatomy and everything, much more than as compared it, because that is the 24 hours, like 48 hours is very crucial time where you won't finish all the reading of your systemic paper. Fourth paper is very easy. Recent advances, you there are hardly any recent advances every year changing, but you must know at least 10 to 20 years what are the recent advances which have been carried out. For getting up a average score, you have to know at least 5 years recent advances, and for getting up a very distinction wise score, you have to at least know how 10 years recent advances is, and you must have by hearted it by that time. And practical, I have told you what all to focus on. I just hope that this video is you have not been very much like, oh, okay, these are all the stuffs you have to do in your third year. Yeah, I have set you out the timelines. To follow it or not, or to make your own timeline, it is upon you. I am nowhere in telling you what to do, but I can just lead you to a path, and a very systematic path, how to go about the studies and everything, and managing out your work life balance along with it. So yeah, if you feel that you like this video, please do share. Please do give a thumbs up. Share it with your friends who need this video, and your colleagues for them who which can help them out for their preparation as well. And also share the subsequent videos with your juniors. Subscribe to the channel. I share much more content on the pediatrics, the ongoing world, the lifestyle. This is Dr. Hemangi Reddy. Thank you.